Hi everyone, I'm Sze. I'm Group Chief Embryologist for TMC Fertility. So today I'm going to answer some of your common questions about IVF laboratory and also IVF treatment. We are currently at our Thomson Hospital lab, which is the easiest and the biggest lab. So we will calculate it from the day that the egg is being taken out from the mother's body. So the maximum number of days that it can actually stay inside the lab is up to 6 days. By the time up to day 6, they are just a clumps of cells. So we are not going to physically grow the baby inside the lab. Okay, so we have two ways of selecting sperm. So one of them is just by morphology. We have a microscope that is going to help us to enlarge the sperm up to 600 times. That helps the embryologist to look at the shape and the size of the sperm, and it helps us to select the best sperm. We can also select the sperm with a chemical way. So with that, we can identify the sperm that is most likely going to give a fertilization and a normal embryo. So now with the advance of technology, we have something called the time-lapse embryo monitoring. We will take a video of how the baby is actually growing inside the laboratory. And by looking at how the baby is growing for 6 days, we can actually identify which is the embryo that is going normal, divisions and development all the way. And that will help us to select the embryo that is going to give the best chance to becoming a baby, and the chances of getting an implantation can go up to 80%. We need to find a balance in between keeping the patient safe and also give them the best chance of getting a baby. So of course, with more eggs, you will get more embryos and you can have multiple attempts to get more babies. But then at the same time, you also put the mother at risk because their body might not be able to take it. So usually the doctor will aim to get the patient to produce somewhere around 12 to 20 eggs. That will give her the best chance of getting a baby, but at the same time also make sure that she doesn't get into embryos. Theoretically, yes, because by putting in 2 embryos or 3 embryos, you increase your chance of getting twins or triplets. But as a healthcare practitioner, we would like to advise the patient because having twins and triplets are very dangerous for the mother as well as the baby. So usually we will discourage patients and advise them to just put in 1 embryo at a time. We will transfer the best embryo into the mother's body, and the remaining of the embryos we will freeze whichever that is usable so that the patient can come back a second time or even a third time for more babies. So when we are growing the embryo inside the laboratory, of course it's not going to be 100% the same situation that is happening inside the mother's body. But we are having very stringent control on all the parameters inside the laboratory in order to give the embryo the best environment to grow. So don't worry, your embryos are in safe hands.